Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Every week I take some of the questions that have been asked by viewer comments through emails or from Instagram, and I roll it all into an episode to bring you guys the #1 question and answer show about medical coding airing on Tuesday. So, if you have a question you'd like to submit for a future episode, comment below or send me an email. I will include my email address in the description box below. So, thank you to everybody who submitted their questions. Let's get started. All right, first question. How does the CCS and the CPC exams differ? So, if you don't know, the CCS is a Certified Coding Specialist, and that is a credential offered with the American Health Information Management Association. Then there's a CPC, which is a Certified Professional Coder, and that is a credential offered with the American Academy of Professional Coders. Now, both of these associations, AHIMA and AAPC, are both the major medical coding association powerhouses. If you want to be a competitive medical coder, you have to be certified through one or the other, okay? So, the difference between the two is the CCS, the Certified Coding Specialist, is going to test you on both inpatient coding and outpatient coding. So, along with the diagnoses coding, right, you have to know how to use the ICD-10 PCS book, which is the inpatient procedures book, and you have to know how to use the current procedural terminology book or the CPT book, okay? So that is the CCS. This is considered the gold standard of medical coding credentials, okay? Because this is a very advanced exam, and testing you on both inpatient and outpatient coding, it takes a lot because there's different rules, okay? And with the CPC, this is only going to be testing you on the outpatient side of the house. So, of course, along with the diagnoses, there's the current procedural terminology book, and that is the outpatient procedures book. And that is what that credential exam is going to be testing you on, is the outpatient setting. So it's important to understand the difference between the two. It's important to understand the differences between all of the credentials. And I've done several videos about this. I will try to leave one in the description box below so that way you guys can really get into like the ins and outs of the different credentials. So hopefully that will help you to decide which credential to sit for first. Okay, next question. As an RHIA, do you need to have a CCS, a CCSP, a CCA, or a CPC? So a Certified Coding Specialist or a Certified Coding Specialist physician-based, or a Certified Coding Associate. These are all credentials with AHIMA, the American Health Information Management Association, or a CPC, and of course we know, is a Certified Professional Coder. Now, with the degree programs, sometimes employers, sometimes, not always, okay, but sometimes employers will ask the degree holders to have a medical coding credential in addition to their degree designation, because of the simple fact that when it comes to the degree designations, their fields of study and concentration are not so much on the coding side. The RHIT, yes, which is a Registered Health Information Technician, this is the associate's degree offered with the American Health Information Management Association. Now, it's a little bit more on the RHIT side because the RHIT degree is meant for more of, like, to put it colloquially, the worker bee, right? But the RHIA is more of the managerial side of the house. These are the people that are in the executive suite. These are the people that are going to be making the decisions. They are not supposed to be doing coding day in and day out. That's why they have coders. Their job is to manage, to lead, to predict, and to forecast any needs that that facility has. That is their job, and their duty is to be captain of the ship. So sometimes they will ask them to have a credential in addition to, but it's not always the case. It just depends on what that person is doing. So you'd have to find out directly with that facility, okay? But it is good, okay? I'm just going to put that out there. It is good to know the rules, and it is good to know the ins and outs of coding as well, okay? The next one is, I obtained 25 CEUs or continuing education units. Recertification cycle hits. Will the system take the 20 CEUs and roll over the excess 5 CEUs into the next cycle? No, because when you are reporting your continuing education units, it has to be continuing education units that are earned between a certain time. Now, for medical coders, this period is 2 years, okay? So you have 2 years to come up with however many continuing education units that you need in order to maintain your credential. There's going to be times when, yeah, you're going to exceed the number of continuing education units, and by all means, you can report them, but it will only take up to, like, for example, in this example here, the 20 that this person needed. Okay, as far as the excess, it will just drop off. It's not going to roll over into the next year, okay? Because we have to stay educated on the most current things possible. That is why that doesn't really happen. We don't have rollovers, okay? I don't think either association allows that, okay? Next question. Oh, here we go. I don't know how I lost my card. Okay. I just started school and I don't feel smart enough. It's overwhelming. I always say this about medical coding. We as medical coders get a very limited time to learn about the whole thing. Medical terminology, anatomy, pathophysiology, about the coding, about the laws. If you are in a decent sized program like 9 months, you get 9 months to learn. That's still considered a very short time. I know there's people out there that are in shorter programs than this. This is why I never recommend going through a really short program. Some people go 16 weeks and they say, yes, we're going to teach you everything you need to learn about coding. I've had discussions about this, but the thing is, when you are in these accelerated programs, it's going to be a lot of information all at one time. We are not doctors. Doctors get 10 plus years to learn this stuff. We get 9 months, okay? And if you're in an accelerated program, even less than that. All right, so you have to be able to cut yourself a break. Does everybody feel like right when they get in, they're so confident that they know what they're doing? No, you're there to learn. So you got to give yourself a break, but you got to improve that internal dialogue. You can't just constantly say, I don't feel smart enough. When you don't feel smart enough, that's when you need to dig deep. That's when you got to dig in and you've got to start studying. You know, sometimes people get very discouraged and they don't want to do the heavy lifting. You have to do the heavy lifting. And what is the heavy lifting, Blue? The heavy lifting is reading. It's taking the time to do flashcards. It is listening to podcasts about medical coding when you don't feel like it. It is actually working through the workbook and working out those coding exercises so that way you can understand. It is looking and seeking out mentors and advice to help you to understand if your instructor isn't helping you or is too busy to help you, which is the case sometimes, unfortunately. There's always the alternative of finding a tutor. Now, there's tons of tutors on LinkedIn that I have seen. I am a tutor myself. My rates are in the description box below. So if you're interested in that, by all means, reach out to me. But when it comes to knowing this stuff, don't start beating yourself up so early in the game. You have to give yourself a chance and go through the motions, go through that uncomfortableness of being new at something, okay? The more that you are willing to embrace that, the easier it's going to get, because you're not going to be so down on yourself. Why can't I get this? Why don't I understand? Look for different ways of understanding. Everybody learns differently. And as adults, we still learn differently. But as adults and not children in school, we know that there are things that we can do to help ourselves, which is study harder and try to find ways of absorbing this stuff and understanding. You know, medical terminology, anatomy, and pathophysiology seems to get a lot of people in the beginning, especially new students. And I get it. It's a lot to absorb. It's a lot to learn. But getting so discouraged that you just stop, you're always going to stop. You're always going to feel that defeatedness if you allow yourself to feel that defeatedness. So with that in mind, you want to make sure that you are saying, I feel this way. Yes, I acknowledge how I feel, but I'm going to get this. And when you start having that go-getter attitude, when you start having that mindset of yes, I can, you would be surprised at all the things that you will be able to do when you have that mindset of yes, I can. So guys, yes, you can. And if you don't feel smart, think yes, I can. Just say those very simple words. Yes, I can. I may feel that way, but it's just a feeling and it can be fleeting. Okay, so exit to the left, a little feeling of I can't get this yet. No, I can't. Yes, you can. That's all I'm gonna say. Next question. My school sent me this book, CPT Plus, a comprehensive guide to current procedural terminology 2021. My question is this the same as the CPT 2021 that you just tabbed? Do they serve the same purpose? They are the same thing. They are CPT books. However, current procedural terminology, there's different publishers, okay? So they're going to be looking different, okay? The book that you have to have in order to take your certification exam is a CPT by the AMA, the American Medical Association. So you have to have the CPT Professional Edition, all right? This CPT Plus, a comprehensive guide, that's not the book that you need. The CPT AMA Professional Edition is the one that you want. But essentially, they are the same thing. It's just this CPT, a comprehensive guide, has different information in it, okay? And for the exam purposes, again, the AMA edition, the CPT Professional is the one that you need. I prefer that one. I have seen other CPT manuals, and I do prefer the AMA edition, but it's all a matter of preference when you are not taking an exam and you are working in a facility, and perhaps they're giving you a choice on which one you want to be able to use, but different publishers have different information in theirs. Some are more comprehensive than others, okay? So I'm just going to put that out there. For me, I trust the AMA edition, and that is always the one that I request when I do get asked, what CPT manual do you want to order? Because every year, my facility gives us books. So every year, I always order the CPT Professional by the AMA. So that's just my recommendation. All right, next one. Does AHIMA or AAPC offer payment plans on their sites for their online classes? You can absolutely find this out by going directly to the websites, but yes, they do. So be sure to check that out. Next question. Does your job require a uniform? I see some medical coders working in scrubs and others in business casual. So it depends on where you're working. When I first started, I had my first job, which was you could wear whatever you wanted to wear. And then my second job, it was you could be in business casual, or you could be in scrubs. So at the time, I was like, oh, I'll wear scrubs. So I had a lot of cute scrubs and things like that. But when I got my third position, they were like, you can be in whatever you want to. You just can't wear scrubs. Okay. So for me, I was like, okay, so I stopped with the scrubs, obviously, because I couldn't wear them. Only people who had hands-on contact with the patients were able to wear scrubs in my facility. So that is why, I don't wear them. But I do recommend, even if your facility says you can wear whatever you want to, I still recommend wearing business casual, because you are in a professional work environment. You are going to be working around doctors, so you do need to look professional. When you are in there, and I've seen coworkers who come in jeans and a t-shirt like they're going to go to a rock concert. This is inappropriate because of the simple fact that you want your providers to respect you. You want your providers to say, oh, this is a professional looking person, I'm going to go ask them. Instead of, who are you? You need to dress for success. Dress for the job that you want, and that is what I always say. So it is important that when you are in these positions as a medical coder and you're working in the facility, that you look nice and that you dress well, because it is going to serve you well when you start working with your providers. And for me, it's always, I love clothes. I love dressing up. if you've looked on my Instagram at Medical Coding with Blue, you'll see that I do dress up all the time. That is something that I love to do because it's important. And to project a good image is very important, especially when you are in a professional work environment. So I would always recommend that. Don't wear jeans to work. I'm just saying. Next question. How hard was the CCSP, the Certified Coding Specialist, physician-based, compared to the CPC? Well, here, I have some statistics for you guys. As of December 31st, 2019, there were 4,995 CCSP credential holders. In 2017, there were 311 first-time test takers with a 73% pass rate. In 2018, the numbers from the United States and Canada, 2018, there were 323 first-time CCSP test takers with a 70% first-time pass rate. And in 2019, between the US and Canada, there were 357 first-time CCSP test takers. There was a 64% pass rate. So every year it seems like it's going down a little bit more, a little bit more. This is a tough exam. This is the outpatient exam and with a HEMA, and it is a very tough exam. This is not something to sneeze at. No certification exam is anything to sneeze at because you have to study and you have to really work hard to really kind of grasp a lot of this information. So this is as far as like in terms of like comparing and contrasting like the difficulty level of each of these exams, it's going to be different for every person, because there's going to be people who say, the CCSP wasn't hard, where other people will say, yes, it was very hard. And if you're looking at the statistics, it'll tell you that, yes, it is hard. It is not an easy exam to pass. And you can find this information on the AHIMA website at ahima.org. So try not to compare when it comes to exams like that, because everybody's gauge for difficulty is going to be different. There's things that I don't consider difficult, but other people do. So it really all depends on the person and their caliber and what they know and how much they're grasping the information. So I don't have an answer for this one. Yeah. Next question. Do you use a computer or a laptop? What do you recommend? Also, do you recommend investing in a computer or laptop? So your facility, if they're going to send you home or if you're working remotely, typically they do provide you with a computer, because they want to make sure that these computers are like free of anything, any bad things that are on there, because when you're working with private information, they want to make sure that all of this is in a good system. Okay, so typically they will send you a computer or they will furnish you one if you're working at home. It really all depends. But I don't recommend going out and buying a laptop, especially if you're going to be working at home. You don't know what computer they're going to be issuing you. So again, they're going to want you to keep this information on those particular computers. If you're wanting to invest in anything, of course, additional monitors would be good if they're not going to provide you with additional monitors. Having dual monitors is really good. Nice big monitors is nice. But whatever suits your fancy. You know, some people are okay to work with just one monitor and like their laptop, you know, that the company provides. So it really all depends on the facility themselves or the company themselves. Okay. And I think that is it. Yes, I went through all the questions. Wow, I went through them pretty fast. But yeah, that is it. Those are my questions for this week. But yes, please continue to send in your questions if you have any other questions for Q&A Tuesday. I like to come on here and talk to you guys and catch you guys up, and it's the great thing about Q&A Tuesday is that it does open up the conversation a little bit more, because I always get lots of additional questions afterward, which fuels another episode. So you know, we'll see what happens and what they come out with. Please like, please share, please subscribe if you haven't already, and I will see y'all on the next episode. Bye!